So today we're performing a physical assessment on the respiratory system. As always, knock on the door, perform hand hygiene and glove. And always identify your patient with 2 identifiers. When we start, we want to ask them about their past medical history, such as history of respiratory infections or any respiratory diseases such as asthma, COPD, bronchitis. We want to know their past surgical history, specifically of lung surgery. We want to know their family history of 1 generation of asthma, COPD, emphysema, lung cancer, tuberculosis, and we want to identify if that's on the maternal or paternal side. We want to know their medication history, such as allergies and reactions, as well as current medications that they are on. We want to know their social history, such as smoking, alcohol, illicit street drugs, residency conditions, highest level of education, occupation, and nutrition exercise. Their diagnostic history, which includes any recent studies that we should be aware of. And then the subjective data starts by asking the patient about any coughing that consists with or without position changes and the type of cough, if they notice any phlegm or blood in the sputum, any shortness of breath or wheezing, fatigue, chest pain while breathing, environmental exposures that may affect their breathing, their last TB skin test or chest x-ray, and their last pneumonia vaccination. Chief complaint was shortness of breath and wheezing. She had no cough, phlegm, fatigue, or pain present. She is currently renovating a house, which could affect her breathing, and her last chest x-ray was on 5/24/2020, and it is unknown her last vaccination. With the objective data, you want to inspect the client for general appearance, posture, and breathing effort. The specific patient's posture is within normal limits, with general appearance and breathing effort distressed before oxygen was administered. You want to observe respirations for rate and quality and breathing pattern and chest expansion. This patient was breathing 20 respirations per minute with equal and steady breathing pattern and proper chest expansion on 2 liters of oxygen. You want to inspect the client's nails, skin, and lip color. This client's nails, skin, and lips are dry, intact, and show no sign of cyanosis or abnormalities. You want to inspect the anterior and posterior thorax for shape, symmetry, and muscle development. And for this patient, theirs is flat with no dysymmetry and muscle development. You want to palpate the chest for tenderness, crepitus, and masses. This patient lacks any chest tenderness, crepitus, or masses. You want to palpate for diaphragmatic excursion, and there is no tenderness or masses noted upon palpation of diaphragmatic excursion. When auscultating the client's posterior, anterior, and lateral sides, you want to start with the posterior, starting from the top, working your way to the bottom in a zigzag motion, counting from 1 to 10, then working on the lateral side, counting from 11 to 18, alternating sides. Then the anterior side, starting with the top again at 19, working your way down in a zigzag till 26. No murmurs or rubs were present upon auscultation.